I'm Joan Cartan-Hansen. Thank you for joining us for this Dialogue Web Extra. We're talking with Dr. Ted Epperly, author of the book Fractured, a look at America's healthcare system, how to heal the healthcare system. One of the things you talked about was the importance of getting more women engaged in the debate over healthcare. Why women?
I think that women absolutely are one of the key answers to the health of our nation. When you take a look at who makes the most healthcare decisions in our country, it's not doctors, it's not insurance systems, it's not hospitals. It's women. It's mothers of families. It's the spouse of a recalcitrant husband. It's an older daughter of aging parents. And so if we engage moms and daughters and spouses in a way in which they are given tools, educational and otherwise, direct communications right into the patient-centered medical homes, to the healthcare system, so that the shift of and focus becomes into the home for healthcare as opposed to into an office, or even more downstream into an emergency room or into a hospital. That shift towards the community, Joan, towards the home, towards moms being empowered and engaged with that, I think we can really start to make some major changes in healthcare happen. I've been fortunate enough to be able to go to 2 third world nations, one in South America, one in Africa. And when we got inside those countries, what we started to recognize from the people there was that if you really wanted to start to do something to help the healthcare of these nations, these countries, these cities, these towns, these villages, is you spoke with the senior women, because they're the ones that could engage the community in a way to focus on health.
Are women not is that women's role not recognized in the current healthcare system?
I think that it's overlooked. I just think it's a partnership that should be maximally developed. I can only imagine if the healthcare system started to focus into the community more, and again, away from the office necessarily, although the office is a great place too, but definitely not in the emergency room or hospital. And it gets to my point that I was making earlier, that it shouldn't be about disease or sickness over here. This is about health, wellness, the management of behaviors and proactive ways to keep the family very functional, very healthy. That, I think, is just tremendous for our country's health. And we've just not done a real good job with that. We tend to do what we're good at. What we're good at is procedures and operations and amputations and treatment of hypertension and diabetes. But what about the prevention of those things? What about exercise at home? What about great nutrition? What about things that will stimulate young minds in ways that will maximize their health for the next 50 years and help teach those family members in ways that can help bring up those kids in ways downstream and grandkids downstream that will be even better educated in that regard. And I think it's just a failed opportunity, quite a missed opportunity, I think, that we don't take a look at focusing on those aspects more.
I did receive a few emails and Facebook questions that I wanted to pass, and these were more preventative questions. So let me ask you. One of them came from, what kind of vaccine should adults have?
Yeah. Vaccinations for adults should continue for many people as we age. One of the most important ones is both diphtheria, tetanus, and pertussis. Pertussis now also known as whooping cough. What tends to happen is you get your childhood series, which ends at about age 12. The immune response to protect you for that lasts maybe 10, 15 years maximum. So all of a sudden, you're now in your mid-20s or 30s, time to be having your own children, and all of a sudden you've had waning immunity. So with pertussis, with whooping cough that we're seeing, and this has become a problem in our nation, is that all of a sudden many moms and dads or grandparents are not immune. They end up getting whooping cough, and then they potentially can pass it on to an infant less than 6 months of age because they haven't started their vaccines quite yet in terms of for a young child that's 2 months of age or earlier. And all of a sudden we've got a major issue where we're passing diseases from caring, loving parents and grandparents on to little kids. So those vaccines, diphtheria, pertussis, tetanus, should be going through one's life. And then, of course, towards the as one ages, you should get an annual influenza vaccine. That's probably the most single important vaccine you can get to make sure that, again, you're going to not get influenza and be kept out of hospitals and emergency rooms. Other things would be the pneumococcal vaccine. You should be getting that prior to age 65, earlier if you have symptoms of lung disease or chronic diseases. And then potentially towards the end of life, a shingles vaccine too.
At what age?
And the shingles vaccine can happen sometime after the age of 65 or so for patients that indeed have had chickenpox when they were a kid. It's the same virus that causes chickenpox. It lies dormant in our bodies. And when our immunity and our immune system tends to wane as we get older, then the manifestation or remanifestation of that virus can be in the form of shingles. So the vaccine, when given after age 65 or so, can help increase the immune system's memory against that virus so that it doesn't reemerge.
I had a question from a woman who wanted to get some advice on colonoscopies. She said it's paid if it's preventative, but if they find a polyp, then under her insurance plan it becomes a procedure and could cost her a lot of money. Should she do that? How important is that colonoscopy?
Yeah, that's a really good question. It is important to have, I think, screening for potential colon cancer. That screening can be done in one way by a colonoscopy after age 50 and then every 10 years as long as everything looks okay. If they do find a polyp, depending on the size of the polyp or how that looks, then there needs to be a biopsy of that. That can usually be done at the same time. It is an interesting twist that biopsy then may become a billable event, whereas the whole colonoscopy is covered by prevention. But I would still contend that it's probably important that if found that it's taken care of right away. Again, it's back to an ounce of prevention is worth a pound of cure on that side. However, there are other ways to screen for colon cancer. For instance, having stool samples in which blood can be looked for. There are other tests that are being developed now to take a look at DNA sampling in stool samples as well for cells that would be consistent with a potential cancer. Also, virtual colonoscopy using different sorts of imaging devices, be it MRI, are being developed to take a look also. And what happens in this procedure is there is radioactive iodine that's taken several days before. That's in your stool. And so the computer then, on an MRI scan, can then digitally subtract the stool out. So all of a sudden you get a very clean image of the inside of your colon. My point in sharing that in gory detail is the fact that technology is advancing in ways in which we probably will be able to do better screening now than the ways we currently are. But that gets back to just one other point I want to make, and that is if they find a polyp, you're still going to have some sort of procedure to get that biopsied, and that's important.
So if you're 50 and above, you probably should still have that colonoscopy.
Correct.
And I had one last question from a viewer. What supplements do you recommend to take and what to avoid?
Right. I think that whole supplement industry is a billion-dollar industry that makes a lot of people a lot of money. My best advice to people is eat a healthy diet, where you're having at least 5 servings of fruits and vegetables a day, protein in the form of whatever meat you like if you're a meat eater that's no larger than the size of your palm. Drink at least 4 to 5 glasses of water a day. If you're eating a good, healthy diet, you don't need supplementation. However, if you do want to supplement, what I would say is a good multivitamin will give you everything you really need. There have been more and more studies that take a look at excessive dosages of either minerals or supplements or vitamins, and they can be harmful. So I think people just need to be mindful. There's no magic bullet out there. If there were, we would know about it. We'd all be taking it. It would be in the water supply, and there's not. So use good judgment, and the soundest and safest habits, I think, are a good, healthy diet, getting at least 30 minutes of exercise at least 5 days a week. If you're doing that, you're doing everything you possibly can, I think, to stay healthy, which again gets back to a whole premise we've talked about, Joan, all day long. And that is that if people are also engaged in their health, and we focus on health and keeping people away from needing what the medical system can do for them, and there's times when that's absolutely needed, then people will maximize both their enjoyment of life, their outcome, their lifespan, and I think we'll just have a healthier nation overall.
We've run out of time. Fractured is the name of your book, and you can find it on Amazon, find it in your local bookstore. Doctor, I appreciate you taking time to join us for this Dialogue Web Extra.
Thank you. Thank you, Jill.
And thank you for joining us. We'll see you next time on this Dialogue Web Extra.